Today I wanted to cover a question that a lot of people ask. How long does swelling last after a total knee replacement? Welcome. This is my channel, Matt Jones here, where we talk about just all things really health. Recently I had a knee replacement about 10 weeks ago, and just wanted to encourage you and hopefully be able to walk you through this, walk it through together here. Yeah, have you ever looked down at your knee weeks or even months after your surgery and thought, why is it still swollen? Well, if so, you're definitely not alone. One of the most common questions people ask after a total knee replacement is, how long is this swelling supposed to last? The truth is that swelling doesn't usually disappear in a few weeks. In many cases, it can last 6 months to a year after a total knee, or even longer after surgery. That doesn't automatically mean something's wrong, though. Got a helicopter flying over. In fact, it's often a sign that your body is it's still healing. Why does the swelling last so long? Knee replacement is a major surgery. Skin, muscles, ligaments, cartilage, bone, they're all affected, and your body's natural responses for inflammation, just healing cells, it increases all the blood flow to that area, and the fluid, it just all rushes to that area to repair all the tissue. The extra fluid is what you see as swelling. Typical recovery timelines, week 1 to 2, it's significant. Swelling, bruising, warmth, tightness, they're all normal. Swelling may extend into the calf and ankle and foot. I know mine did. It was really swollen in the calf and even my foot a little. Week 2 to 6, pain often improves before swelling does. Many people are surprised by this. It's true. The pain is a little better weeks 2 to 6, but yeah, the swelling is still there, unfortunately. Weeks 6 to 12, better motion and strength develop, but the swelling commonly returns after activities. So that's kind of where I am. I'm week 10 post-op, and the swelling just, after a long day up on my feet, it definitely returns pretty full force. So months 3 to 6, they say, mid or mild swelling, warmth and stiffness remain common, especially after long days. So the more you work it, the more you up doing, it's still gonna get, pretty stiff. And just like my surgeon said, it could be 6 to 12 months before it could even be longer than that, until the internal healing is, complete, really. Occasionally, swelling after busy days is still considered normal for many patients. So, we're in it for a year. You get a total knee, it's kind of life-changing for a year. I did know that going into it. My surgeon was very honest with me up front, and he told me he didn't want to see me again for 6 weeks after he did the thing, because he said he didn't want me to punch him. So anyways, I thought that was funny. Why does swelling come back? Activities like shopping, yard work, vacations, long walks, or even gym workouts can temporarily increase all that inflammation, because the healing, tissues are still very sensitive. What makes swelling worse? Really, it's just activity. Standing too long, sitting too long can even do it. Over exercising, which is my problem. I tend to do that. Hot weather, high sodium foods, poor sleep, and excess body weight can still, contribute to all that too. Um, what helps, you know, icing is really what helps me. 15 to 20 minutes. I do it several times a day. I haven't been doing it as much in 10 weeks post-op here, but I definitely, in the first 6, 7, 8 weeks, I was icing all the time. Proper elevation with the ankle above the heart, that helps a lot. Compression, if your surgeon is approving it. Um, Frequent short walks, I did that a lot around the house. And staying hydrated helps a lot. Eating anti-inflammatory foods and gradually strengthening the leg muscles, just a little at a time. Can't do too much, it just overdoes it. Is warmth, warmth to the touch when you touch your knee, is it normal? Yeah, it definitely is. Many patients experience a warm knee for really several months, because of healing, and just it increases that blood flow and it makes it just warmer. When should you call a doctor? You should always seek, medical care if you develop a fever, drainage, rapid increasing redness. Mine did a weird thing about 4 to 5 weeks into it, and it just got completely red on the right side of my thigh, like a big old, I don't know, 6-inch diameter circle of red. I was like, what in the world is this? So I called the doctor, sent them pictures and all that, and they weren't worried about it. They put me on an antibiotic just in case, and sent me on my way. So it's just a phone call, really. They can usually tell from pictures, just sending pictures in. It's not too hard, really. But yeah, sudden severe pain. If you have severe pain, that's probably a good sign to call your team. The worst thing is when it happens on the weekends. I had it happen a couple times on the weekends. I'm like, oh man, I guess I'll wait till Monday, but I was in some pretty serious pain. Difficulty breathing and swelling that suddenly becomes like dramatically worse, like if it's really inflamed, or basically, use your best judgment. Don't be silly. It's a pretty serious thing. It's major surgery, and you want to make sure you're taking care of it. Don't compare your surgery or your recovery, to others. Just because someone else says, oh, mine was so easy and this and that, and then it doesn't matter. I've heard it all. My doctor, he was adamant, that 60-year-old plus women, they have the easiest time with, knee surgery. They bounce right back. No big deal. Mine was a lot different. I had a lot of trauma before with the motorcycle accident, and it was just a lot more healing I had to do. And healing, it isn't measured in days anyway. It's measured in, the long term, in the months. Compare yourself today where you were a month ago. That's a good, small improvements over time is a big deal. You want to definitely make sure you're documenting. I didn't document enough, I don't think, but I'm doing it now, 10 weeks post-op, but I want to document everything just to really make sure, I'm doing the right things with it. And, but yeah, just really highlights, just if it's swollen, ice it, elevate it over your heart. If your doctor says compress. Do the thing. Follow the doctor's orders. I know they seem like they don't have all the answers, but they are pretty smart. do what they say. I hope this video helps with, you know, answers to swelling and just in general. You're going to be swollen for a good year. It's not going to be all the time the same, but it's gonna take a year, they say, maybe even a little more before it goes back to normal. It's just so much trauma that happened in that area, all the cutting the bone and just all the things they had to do, you know, putting the new hardware in. So yeah, if this video helped you answer your questions, you know, please like, subscribe it, subscribe my channel, you know, share your recovery in the comments. I'd love to hear it. Mine's a pretty long story. Check my other videos out. I mean, it was I'm 9 years in the making here. Motorcycle accident happened in 2017, and I'm still doing the thing and working on getting better even yet. So keep pushing, do the exercises, push through this swelling and this pain, and a year after your surgery or so, it's gonna get a lot better. I'm looking forward to it. So yeah, just, you know, keep your head up, do the exercises, do the thing. Hope this helped. Definitely watch my other videos, subscribe, and we'll be seeing you on the next one. Thank you.